Okay, so now we are going to look at some of the points that are very important about epidural and spinal anesthesia. Major contraindications of neuroaxial anesthesia are: if patient is not giving consent, we do not have to proceed, are any coagulopathy, bleeding disorder, hypovolemia, any infection at the site of injection, any intracranial pressure raised, or any infection at the site of spinal or epidural or lumbar vertebrae. In epidural anesthesia, there is a technique in which there is sudden loss of resistance happen after interspinous ligament and ligamentum flavum. Then there we have to identify the epidural space for injection of anesthetic agent. Entry into epidural space after passing flavum ligamentum, and site is performed at the lumbar, thoracic, and cervical level. And lumbar vertebrae L4, L5 is L3, L4 is good place for performing epidural anesthesia. Its uses are surgical anesthesia, obstetrics, postoperative pain management, or chronic pain management. So same goes for thoracic epidural anesthesia. Onset is 10 to 20 minutes. Block density less dense than spinal. It is advantageous in some cases. Larger dose, larger volume, and concentration is required than spinal anesthesia. Toxicity risk is more. Severe toxicity can occur if full epidural dose is accidentally injected intrathecally or intravascularly. So this thing has to be ruled out. Another one is spinal anesthesia technique is needle should pass through epidural space and then into subarachnoid space for free flow of CSF, where we have to inject the dosage. It is rapid in onset, takes minutes in action. Block density is dense, motor and sensory block occurs, and there is epidural anesthesia allows prolonged control of anal anesthesia via catheter for repeated dosage, wider application than single shot spinal anesthesia. Epidural is used more. Another one is the caudal epidural anesthesia. It is type of epidural in which is given in sacral hiatus and common in children or lower body surgeries. This anesthesia is used. So these are some of the points that are very important that you have to keep in the mind and memorize.